Welcome back to the Truth About Utilization Management, what every nurse needs to know, presented by Healthcare Nurses Network and Nurses Link Up. In our last episode, we established the crucial difference between proactive utilization management and reactive utilization review. Now, in episode 2, we dive into arguably the most critical skill for making proactive work, medical necessity documentation. Your charting is powerful. It tells the patient's story, justifies the care you provide, and directly impacts reimbursement and patient flow. As Dr. Nicolas Abella highlights in his second article, vague or incomplete documentation isn't just inefficient, it's a major reason for costly denials and can even put patient care coordination at risk. Are you unknowingly leaving money on the table or falling into the check-the-box trap? Get ready, because James and Emily are about to break down Dr. Abella's guide to moving your documentation from vague to vital. They'll discuss mastering the key elements: acuity, intensity of service, response to treatment, and share practical strategies to denial-proof your charting. Here are your hosts, James Carter and Emily Ramirez.
Welcome back to the Healthcare Nurses Network podcast. We're here to give you guys the knowledge and strategies to not just survive, but thrive in your nursing careers.
Absolutely.
And today, we're going to be tackling something
Yes.
that could be a little bit of a chore,
Yeah.
but is actually your secret weapon for better patient care and a smoother workflow.
I like that. Secret weapon.
Medical necessity documentation.
Yeah. It's so important. We're diving deep today into an article
Okay.
by Dr. Nicolas Abella titled Medical Necessity Documentation for Nurses, a Guide to Preventing Denials.
Oh, preventing denials. I like that.
Yeah.
It's a good one.
It's packed with insights that can transform the way you approach documentation.
I think every nurse listening has felt that pang of frustration when they're really hard work.
Right.
And dedication doesn't translate
Yes.
into proper reimbursement
Absolutely.
for the hospital.
Mm-hmm.
And often it boils down to something as simple as documentation.
It's so true. The landscape of is changing.
Yeah.
We're moving beyond those retrospective audits.
Yeah.
And into a world of proactive, detailed documentation.
Proactive, I like that.
That truly reflects the medical necessity of every intervention.
So no more checking boxes
Well,
on those flow sheets
not anymore.
and hoping for the best.
Payers are scrutinizing every detail,
Wow.
looking for clear evidence that justifies the care provided. And if your documentation is weak, it could lead to denials and lost revenue for your hospital.
And that hurts everyone in the long run, right?
Yes.
Not just the hospital's bottom line,
Right.
but also our ability to give the best possible care
Exactly.
to our patients.
So how do we make that shift from simply recording what we did to truly capturing the why behind our actions? Dr. Abella has some really interesting points on this. I'm excited to unpack them with you.
You too. One thing that stood out to me was his critique of the traditional SOAP note format.
Okay.
I mean, we've all been trained to use SOAP notes,
Yeah.
but is it really enough in today's complex healthcare environment?
That's a great question. And Dr. Abella argues that relying solely on the subjective portion of the SOAP note can weaken our documentation. Think about it. If you simply chart patient reports pain, it's lacking the objective evidence that payers are looking for.
So instead of just saying patient reports pain,
Yes,
we need to paint a clearer picture.
exactly.
What kind of details should we be including?
Use specific measurable terms.
Okay.
Instead of just mentioning pain, quantify it on a scale. Describe any visible signs of discomfort like grimacing or guarding, and always include relevant objective data like vital signs.
That makes so much sense. I can already see how those small changes
Yes,
can make a big difference in the overall strength of our documentation.
absolutely. It's about moving beyond generic statements
Okay.
and providing concrete evidence that supports the medical necessity of our interventions.
I like it. Dr. Vella also talks about the limitations of flow sheets.
Yes.
I know I rely on them heavily,
Uh-huh.
but it sounds like they might not be telling the whole story.
Flow sheets are great for capturing routine data, but they often lack the space for those nuanced details and clinical judgments that truly showcase the complexity of patient care.
So when do we bring in those narrative notes? I'll admit, sometimes I feel like I'm writing a novel when I use them.
Think of narrative notes as your opportunity to provide context and explain your rationale for actions that deviate from standard protocol. For example, if you're changing a patient's medication, A narrative note allows you to explain why you made that decision, the patient's response to the previous medication, and any specific considerations for the new one.
That's a great example. It's about connecting the dots for anyone who reviews the chart
Right.
and
Yeah.
showing that our actions are driven by careful assessment
Yes,
and clinical reasoning.
exactly. And those detailed narratives are crucial for demonstrating medical necessity, especially when it comes to justifying a higher level of care.
This is really making me rethink my whole approach to documentation.
Okay.
I'm starting to see it less as a task and more as a tool for advocating for my patients
Yes.
and ensuring they receive the appropriate level of care.
That's the mindset shift we're going for. And to help you structure your documentation effectively, Dr. Abella introduces a really helpful framework called AR, Acuity, Intensity, and Response.
Ooh, I love a good acronym.
Me too.
Break it down for me. What does AR encompass?
So acuity refers to the severity of the patient's condition. It's about painting a clear picture of how sick or injured they are using objective data to support your assessment.
So instead of simply saying patient is short of breath, we
Yeah.
can include specifics about their respiratory rate, oxygen saturation levels, and any other relevant findings.
Precisely. The more specific and detailed you are, the better you'll convey the patient's acuity to anyone reviewing the chart.
Okay, got it. What about intensity? Where does that fit into the picture?
Intensity refers to the level of care the patient requires.
Yeah.
You need to clearly document all the services provided and explain why each one was necessary for this specific patient at this specific time.
So if we're providing frequent vital sign checks, administering medications, performing wound care,
Yeah,
we need to explain why those interventions are crucial
right.
for this particular patient's condition.
That's right. It's about demonstrating that the patient's needs warrant a higher level of care than someone who is stable and recovering well.
Okay, acuity and intensity.
Yes.
We're 2/3 of the way there. What about the R in AR?
Response. This is all about documenting the patient's progress or lack thereof in response to the interventions we're providing.
So we're not just documenting what we did, but also how the patient responded to it. Did their condition improve? Did their pain decrease? Did their vital signs stabilize?
Exactly. Tracking and documenting patient response is crucial for demonstrating the ongoing need for skilled nursing care.
This AR framework is brilliant.
I know.
I can already see how it can help me organize my thoughts and ensure I'm capturing all the essential elements for justifying medical necessity.
It's a game changer, for sure. And, if you're looking for more resources and tips on mastering documentation, be sure to check out healthcarenurses.net. We've got tons of helpful articles, templates, and even real-world documentation examples to guide you.
Awesome. We'll be sure to include those links in the show notes.
Great.
But for now, we're going to take a quick pause and come back with even more insights from Dr. Abella's article. Stay tuned.
Welcome back. We're uncovering some really powerful strategies for medical necessity documentation, and one of the most surprising points Dr. Abella raises in his article is this idea of starting discharge planning documentation on admission.
Yeah, I was surprised by that too.
Right.
It seems counterintuitive to think about discharge when a patient has just arrived.
I know.
But I'm curious to hear the rationale behind it.
Yeah, it's all about being proactive and anticipating potential barriers to discharge early on. By documenting those potential challenges and the steps we're taking to address them, we're creating a roadmap for a smoother transition for the patient.
That makes sense.
Yeah.
It's like we're building a strong foundation from the very beginning rather than scrambling at the last minute to put everything together.
Exactly. And remember, clear, comprehensive documentation is essential for justifying the medical necessity of those discharge services.
So what kind of things should we be documenting in those early stages?
Think about the factors that could impact a patient's ability to manage at home after discharge. Social determinants of health are crucial. Does the patient live alone? Do they have a support system? What are their financial resources? Documenting these factors early allows us to loop in social work or case management if needed.
So it can help us anticipate and address those challenges before they become huge roadblocks to discharge.
Exactly. And don't forget about functional status. Can the patient ambulate independently? Do they need assistance with activities of daily living? Documenting these details helps justify the need for skilled services or home health care.
So we're really painting a picture of the patient's needs and creating a plan that sets them up for success after they leave the hospital.
Precisely. And that level of detail and forethought is what really sets apart strong documentation.
You know, speaking of strong documentation,
Yes.
Dr. Abella touches on that age-old saying, If it wasn't documented, it wasn't done. How much truth is there to that?
Oh, there's definitely a lot of truth to it, especially when it comes to medical necessity and preventing denials. Documentation is the proof that supports the care we provide. However, it's also important to find a balance. Over-documentation can be just as problematic as under-documentation.
So it's not about documenting every single thing we do, but focusing on what's relevant to medical necessity and patient care.
Exactly. We need to be thoughtful and intentional with our charting, ensuring every entry adds value to the patient's story and supports the justification for their care.
That makes sense, but I know a lot of nurses struggle to find the time for thorough documentation, especially when we're juggling multiple patients and like a million other tasks. Any tips for making it more manageable?
Absolutely. Dr. Abella suggests a technique called the 5-minute documentation drill. It's about dedicating a few minutes during or right after each patient encounter to jot down key findings and interventions.
So instead of trying to remember everything at the end of a crazy shift, we're documenting in real time.
Exactly. Think of it like mini charting sessions sprinkled throughout your day. You can even use a pocket notebook or a voice recording app to capture those quick notes if you're away from the computer. Then when you have a few minutes, you can transfer those notes into the EHR.
That's a great strategy. I love that.
Yeah.
Capturing those details while they're fresh in my mind.
Absolutely. Another key point Dr. Abella emphasizes is being mindful of the language we use in our documentation. We need to move away from those vague terms, like stable, tolerating well, or no complaints.
I'll admit, those phrases are staples in my documentation vocabulary.
I know.
What's wrong with using them?
They're just not specific enough. Remember, we want to paint a clear picture of the patient's condition. Instead of simply saying stable, describe their vital signs, mental status, and overall appearance. Instead of tolerating well, describe how they're interacting, their level of activity, and any specific observations you've made.
It's about showing, not just telling in our documentation.
Exactly, and let's not forget the importance of documenting communication with other healthcare professionals. Phone calls, emails, face-to-face conversations with physicians, therapists, case managers, it all needs to be documented.
It's a good reminder. It's easy to overlook those quick conversations in the hustle and bustle of our day, but they play a crucial role in coordinating patient care.
Absolutely. Speaking of navigating those hurdles, let's talk about some of the challenges nurses often face when it comes to documentation.
Lack of time, clunky EHR systems, I think we've all been there.
It's a reality for many nurses, but instead of viewing documentation as a chore, we need to reframe it as an investment in patient care and a crucial tool for denial prevention. When we understand the why behind thorough documentation, it becomes less of a burden and more of a powerful tool in our arsenal.
Yeah, I love that reframing. It's not just paperwork, it's advocacy.
Yes.
It's about ensuring our patients receive the appropriate care and resources they need.
Exactly. And when it comes to those time constraints, we need to get creative. Utilizing templates and smart phrases in the EHR can streamline the process, but remember to always customize them to the individual patient.
And what about those EHR systems that seem designed to make our lives harder?
Don't be afraid to advocate for improvements. Talk to your IT department, your nurse managers, your CNO. Bring specific examples of how the system could be more user-friendly and conducive to thorough documentation.
We have a voice, and we need to use it to advocate for systems that support both nurses and patients.
Absolutely, and remember, we're not alone in this journey. If you're feeling overwhelmed or frustrated, reach out to your colleagues, seek mentorship, and tap into those online resources. Healthcarenurses.net is a great place to find support, tips, and a community of nurses who are passionate about elevating documentation practices.
Awesome. We'll be sure to include those links in the show notes.
Great.
But for now, we're going to take another quick pause and come back with the final part of our deep dive. Stay tuned.
And you're back for the final part of our deep dive. As we've been talking, I've realized that this is so much more than just avoiding denials or keeping the hospital happy. It's really about stepping into our power as nurses.
Absolutely. Dr. Abella talks about nurses becoming documentation champions, and I think that's such a perfect way to frame it.
Yeah, I love that phrase. But what does it actually look like to be a documentation champion, like in our day-to-day practice? It's about recognizing that strong documentation is the foundation of exceptional patient care. Every entry we make has the potential to improve communication, enhance patient safety, guide clinical decisions, and ultimately lead to better outcomes.
So we're not just recording tasks.
Right.
We're shaping the patient's story.
Yes.
and advocating for their needs.
Exactly. And when we document with that level of intention and detail, we're showcasing the value of skilled nursing care and justifying the resources our patients deserve.
It's almost like we're shifting the narrative from documentation as a chore to documentation as a superpower.
I love that. It really is a superpower.
Right?
We have the ability to impact patient care in a really profound way through our documentation.
So how do we embrace that superpower?
Yeah.
Where do we start?
It starts with taking ownership of our documentation skills. We need to be lifelong learners, always seeking ways to improve and refine our practice. That could mean attending workshops, reading articles, shadowing a colleague who's known for their stellar documentation, or even just taking some time for self-reflection.
I imagine there are tons of resources available online as well.
Oh, absolutely. Healthcarenurses.net is a fantastic resource. You'll find articles, templates, checklists, real-world documentation examples, and even a really supportive community of nurses who are passionate about this topic.
Awesome. We'll be sure to include those links in the show notes for everyone. Becoming a documentation champion isn't just about honing our individual skills, though, right?
No, it's also about sharing our knowledge and empowering others. We need to mentor new nurses, guide our colleagues, and advocate for system-wide changes that support effective documentation practices.
So it's a collective effort,
Yes,
a team sport.
it is. We're all in this together.
We are all in this together. When we all raise our documentation game, we raise the standard of care for all of our patients.
That is so true. I love that.
This has been such an eye-opening conversation.
It has.
I'm starting to see documentation in a whole new light.
Yeah, me too. It's not just about paperwork. It's about advocacy, patient safety, and professional pride.
Before we wrap up, I want to leave our listeners with one final thought-provoking question to ponder. As you continue on your nursing journey, think about this. How can you use your documentation skills to not only prevent denials, but also to advocate for your patients and elevate the nursing profession?
That's a powerful question.
Yeah.
I hope everyone listening will take it to heart.
And remember, you don't have to do this alone. Head over to healthcarenurses.net for more tips, resources, and a supportive community of nurses who are passionate about mastering documentation.
Yes, we are all in this together.
We are. Thank you for joining us for this deep dive into medical necessity documentation. Until next time, keep learning, keep growing, and keep advocating for the best possible care for your patients.
And for yourselves.
Thank you for listening to the Healthcare Nurses Network podcast. We'll see you next time.